it is possible for COVID-19 to spread from the corpse if you're touching the body. And so this is why, we do not want open casket funerals. This is really touching a body is a bad idea. Because probably when someone has died, they are secreting a lot of virus. And I can't tell you that I know what embalming practices are in other countries or what the preparations are for the body, but it is really recommended not to have open caskets for just this reason. But I think the major concern about funerals is people being together and not social distancing. Because of course at funerals, people are, someone is crying and you want to touch, you want to hug them, you want to hold them, you want to comfort them, and this is a natural response, and it's very hard not to do this. And this is really the major reason for not having funerals, is really to protect the health of people. And of course you worry that, the family of this person, they may have been exposed, they could come and expose other people. We understand, what a painful time, how painful it is to, of course, lose a loved one, especially if they've, perhaps been isolated in a hospital. You may not have been able to see them as much. It is very distressing. And, we ask for people to try and find other ways to mourn, to maybe have a small funeral service for just the family. And then to perhaps provide or to have a funeral service where you just have a limited number of people coming at certain times and try to practice social distancing. I know this is challenging, but we ask people to try and get creative. I have been on I had a colleague of mine who died. In fact, the colleague whose dogs I adopted, she died. We did a Zoom memorial, and it was really very, very beautiful. Someone put together, their favorite music, put together pictures. So there have been these types of memorial services for people. We've seen them, we've gotten together for Father's Day events. We've gotten together for numerous types of events. So trying to do social media is another way to do that. Maybe there's a place, a public place that people could come and leave flowers for, or some other way to express support for the family. If it's donating to an organization, or helping to sponsor a meal, or dropping food off for the family. That can be one way to show support. But we really don't encourage funerals, and we certainly don't encourage open caskets. They are a risk. This is where I think that having a plan is so very, very important. So that there is a sort of progression of steps that you take before you feel that you have to go to the hospital. Especially if you're in a community where hospitals are overwhelmed and turning people away. So it is to make a plan. What are we going to do if we have a fever for a day? What are we going to do if it starts to get worse? Does my doctor, what is my doctor advising that I do? It's to make a plan. I would tell people that if you have severe illness, staying home is not a good idea. But again, this is where making a plan of where am I going to go for health care? Who am I going to call? And you don't need just a plan A, you don't need a plan A, you need a plan B, a plan C, and a plan D. And if at all possible, this is, again, why we recommend for people to be sure that you have a supply of over-the-counter medicines at home. And that is, so that you have as much in your own arsenal at home to help treat this as possible. And work with your healthcare provider for a plan of treatment. And part of this is also to avoid going to the hospital, is to stay home if you are ill, is to not go to work, where you can infect other people, and where you will run yourself down, is to take care of yourself, to isolate from your family, because the one thing that you don't need is you don't need more people getting sick. So it is about planning, it's about having supplies on hand and having several different options available to you. I can't guarantee that you won't then end up in a circumstance where you will have a shortage, but at least you will not have wasted as much time running around, because that can cost you. And the more effective and the more strategic you can be, the better your chances of surviving an outcome. And the less stressed out you are if you are sick, knowing that there's a plan in place, knowing that everyone knows what they're supposed to do. I would, as an example, when I was working on my PhD, I started sailing. And often when you're out sailing, there could be a storm that comes up on the lake. Everyone knows what they're supposed to do on the boat. You're doing this, you're doing that, you're doing this. Everyone falls into line, and that's how you stay safe. Because if everyone starts running around, then nothing gets done and disaster happens. So having a good plan, having supplies is very important. But do not seek medical care if you need it. And especially if you have underlying conditions, this is the time to really take care of those things, because you don't want them getting out of control during a pandemic. So if you have high blood pressure, stay on your medication. If you start to experience issues with your diabetes, if your reading becomes out, if your glucose readings become too high, talk to your doctor. But stay on your medications and keep them under control. That is very crucial. You don't want your asthma or anything else getting out of control during a pandemic. So my mom and I just went shopping, and I wash fruits and vegetables. I usually put a little bit of dish detergent in the sink, and because soap is very good, I let them soak for 10 minutes or so, and then I rinse them off and let them air dry. So I would recommend doing this with fruits and vegetables that you can do this with. It's a good idea. In most marketplaces, there's a lot of people touching stuff. So, and things are open and uncovered. We'd like to think that no one, but people talk over the vegetables. Someone's talking over your broccoli before you got there. So wash it off. I recommend it. Some people will take things out of anything that's in plastic and put it into a plastic bag. You can, if you want to, and wipe off and throw out the plastic wrapping and put things into your own plastic bag. Just be sure that, you're being very careful about what you touch and washing your hands in between things. You don't want to touch a bunch of dirty plastic and then put away the fruit that you just cleaned, So again, it's just watching what you're touching. I have friends who, if they get a delivery, they want to let the cardboard box, they want to let their mail sit for 24 hours before they touch it. Okay, you can do that. I won't say no to those things. But I think that for fruits and vegetables, I say that you wash them. And then just again, being very careful with your own food preparations, washing your hands before and after you start. Again, we don't think that food is not a mode for transmitting the virus. It's more about you getting those things on your hands and giving them to yourself. I know that people have been talking about vitamin D. Vitamin D is good for your immune system, but most of us get vitamin D from exposure to the sun. So if you're outside, you probably get adequate exposure to vitamin D. If you don't, there's nothing, there is nothing wrong with doing anything that helps you feel better these days. And so, you know, I should probably take my multi-mineral every day. I probably should be taking my fish oil for my memory and all of those things. And if ever there was a time to be diligent, now is the time. So these are not things that can hurt you. Take them in moderation. You can take too much vitamin C and it causes stomach problems. So, you know, you don't want to suddenly start taking tons of everything because that can throw your system off too. And then suddenly you don't know whether your upset stomach is, you know, an upset stomach or something worse. So again, multi-mineral, you know, your multi-mineral vitamins, yeah, take them. It's a good idea. You know, my aunt has, you know, I have someone in my family who has some respiratory illnesses, and they said, you know, should I, you know, like steam, like, you know, boil water and put the herbs in, and will this help? And I said, I don't know that it will do anything for COVID-19, but if it makes you feel better and makes you feel relaxed, do it. Because those things are good for your immune system. You know, if, you know, getting some steam on your face helps you relax and helps you breathe and opens up your sinuses, do it. Anything that makes you feel good is good for your, it's good for you emotionally, it's good for you physically, do it. You know, if there was a time that you should be meditating, and I just did my little 10-minute calm meditation before I came on, do it. Things that make you feel good are good for you. They're good for your immune system, do them. You don't need a medical, does it have antiviral properties? No, but it has good immune property, it has good health properties. So things that make you feel good, do them. I play tennis. I have not stopped playing tennis because you're across, you know, a court from someone. So exercise, get outside, you know, you know, this is a time to call up your friends that you've been meaning to call because you're home, you're not seeing friends going out as much. All of those things make you feel good. Your social connections are incredibly important to you. So all of those things that make you feel good, do them. We are reliant on information for making those decisions. Most places have decided they're not going to be open until there has been, you know, X number of weeks of a decline. So I would tell you, you know, gather as much information as you can about what's going on around you. And I don't know that anyone should be thinking of ending social distancing completely. I don't know that anyone should be thinking about immediately going back to the way things were, because you can't and you shouldn't. So I would say that, you know, again, we're relying on information. You know, what is the count, the daily count in cases? What's, you know, the count for death? You know, is there adequate testing where you live? So that you know that you can look at the percent positivity in your community. Information about hospital capacity. There's information that governments are putting out about, you know, we have, you know, we're at 90% capacity, we're at 98% capacity. And then you really do have to judge your own, you know, if you're going to not isolate, are you going to be wearing a mask? You know, is how consistent can you be about practicing preventive activities? Can you always wear a mask? Will you always wash your hands? Will you always be careful about what you allow to come into and out of your house? And then the people that you may be interacting with, are they people who have underlying conditions? You know, are you putting them potentially at risk? Do you have parents that live with you? Do you want to take the chance of you going out to a bar and having a great time with your friends and then coming home and giving something to your parents? Are you going to be socializing with your children? You know, children are great vectors for illnesses. You're going to take your children out. They're going to interact with other kids. You know, so there are all of those things to think about. But I would say that even if you're thinking about not staying home all the time, you should have on a mask. And you should practice social distancing as much as possible. And you should be cleaning your hands, and you should be cleaning the surfaces of your workspace and your home as often as possible, or as often as is needed. But to say that you're suddenly going to stop this, I think would be, I think that that would be very foolish. I think that we've only looked at what's happened here in the United States, and we have cases going back up where people are quotes reopening. No, you should not go to large gatherings. No, you should not go to the beaches. I just don't think that those are really smart decisions to make at this point. And I don't think that anyone should be considering any of those things. I mean, in my personal opinion, and I'm not sure that I can say this, that this is what the CDC would say, but we are expecting another wave in the fall. So, because that is how respiratory illnesses work. When the cold season comes, they survive better, and we tend to be indoors in close contact with people. So this is where respiratory illnesses go up. So we need to get through the fall. We need to get through the winter before anyone thinks about doing anything close to going back to normal life. And even then, it should be a very slow process. You start to circulate with the people who are in your immediate family and friends, and you socialize with them a bit, what's been happening in their lives, their communities, their families. But I would say we've got to get through the winter before anyone really thinks about dropping any of these preventive measures. That's just my opinion. And that's probably what I'm going to practice. Now, I sort of have what I call my quarantine. I have very close friends who I've seen, since this has started. They came back from overseas. They have kids. I see the kids. We've met for dinner outside on the patio. And I have a couple of other close friends that I am going to see. We're gonna social distance while we're inside, or we're gonna be outside, and those I'm going to spend time with, and I'm going to keep that small circle. And yes, we are all CDC people, and so if something happens, yes, we would pick up the phone and call each other, and say, I've got this. I just want you to know, and everyone would take the necessary precautions to isolate or to quarantine. So. That's sort of the way I'm planning on living my life. We may be going back to work, but it will be with social distancing. We probably will be going back in limited shifts, so that not all of us are in the office at the same time. But I don't think it's time for anyone to think about, not using all of these preventive measures. That was also one of the theories that was sort of proposed in Sweden, and that was we want to protect the elderly and the vulnerable population, and that we figure that we will allow the rest of the community to naturally develop herd immunity by being infected, because most people will recover, and we have adequate healthcare facilities to take care of those people who get sick. That was one of the theories in Sweden. Sweden is not seeing a leveling off in cases as they had hoped. So the issue there is we don't know what immunity is. We don't know that if you get infected, that provides you with long-lasting immunity. We don't know if that doesn't mean you can't be reinfected. Think about it. A cold is a coronavirus. We get colds all the time. We still keep getting them. So just because you've been infected with it doesn't mean that you have immunity. So that is a bit of a, at this point, we don't have enough information to say that is an effective strategy. And it doesn't appear to be that it is, although I will say the data on that is still not in yet. We just don't know yet. in terms of, a vaccine, you do need a large percentage of the population to be vaccinated in order to have herd immunity. Like I said, measles, we want 95% coverage for children, children under, you know, children under 5, or that's what we want. What's it going to be with COVID? We'll see what it's going to be. Vaccines can be 80% effective in a population. They could be 95% effective. So it's going to depend on what that is. That's going to tell us what percent of the population we need to cover to have herd immunity. But it's a good chunk. I don't think you're looking at anything less than like 80 or 85%, vaccination coverage in order to have herd immunity. It's high. It's high. I mean, think about how much influenza we have every year, and we have a flu vaccine. We don't have, flu vaccine coverage in the United States. I'll check it out, but I would be surprised if it's above 30% or 40%. But we're very good about the childhood vaccinations, and so we do get high coverage rates for those things. And so we do have herd immunity, but we need everyone who can be protected to get protected. Because there are some people who can't be vaccinated. There's some people who have allergic reaction to certain vaccines, they can't have it. They may have some underlying conditions, they may have a medical condition that doesn't allow them. So those people need to not get the vaccine. That makes it even more critical that those who can do get it, because then you're protecting other people. But again, herd immunity really has to be quite high. I think that it's been very rare that someone is completely asymptomatic. That's quite unusual. What they have found is that sometimes people sort of fall off the cliff, as it were. You can sometimes have COVID-19 and you actually are able to compensate for the damage that it's causing. So you're able to keep breathing until suddenly you're just not able to. And so what we've seen is that sometimes people seem to be having mild illness, and then suddenly they just go into crisis. And it's probably because what's been happening is they have been, their body has been slowly starved of oxygen. And then they just sort of reach a plateau where they just go boom. That the body's been so deprived of oxygen that they go into respiratory failure, and they start to not be able to breathe. One of the things that people have said, is that you can have what's called a pulse oximeter, and you put it on your finger, and it reads the level of oxygen in your blood. And so if you are someone who has risk or you have underlying conditions, checking that would let you know if perhaps your pulmonary function is somehow being compromised in advance of there being symptoms, because then you would see your oxygen level falling. But people being purely asymptomatic and then suddenly coming down with severe illness, I'm not saying it can't happen, but it's not the normal, it's really not the normal course of events. There can be damage to the respiratory system. There can be, you can have damage to some of your internal organs. So there are instances where people do have sort of, very, very slow recoveries. And it is an individual thing. Most people feel, I've had some people who had COVID and they were just like, I really thought I was going to die for 2 days. They were like, it was the worst flu I've ever had. And then they got over it and then they were fine. Other people have taken, a couple of months to sort of recover. They've just been very weak. It's taken them a while to get their lung capacity back up, to build back up their stamina. So there can be long-term, what we call sequelae, in terms of long-term health effects. Most of these resolve, but not all of them do. And again, if you are continuing to experience these symptoms, you definitely should be talking to your doctor, because perhaps there is another condition that has been sort of triggered by this event, or perhaps your immune system has become weak and now you have something else happening. So if these things are ongoing, you should definitely consult with your healthcare provider. But yeah, you should give yourself time to recover before you go back to normal activity, before you go back to being around people, and to be sure that you're safe and you're not infectious anymore. Most of the guidelines, or the guidelines in the United States we have, is it has to be at least, how do I say, 7 days since you were at least 7 days since onset of illness, that you can think about sort of going back, being around people that is still still practicing good um, safety precautions, but at least 7 days since you were ill, plus 3 days of no fever, without aspirin or any medication or over-the-counter medication, and a continued improvement in cough or sore throat. So, that's generally, 3 days without fever, without having to take any, paracetamol or aspirin or anything, plus 7 days. So you should at least be sure that you're giving yourself enough time to rest and recuperate before you go back to doing anything.
This has been just incredible. Thank you so much.
Thank you so
It is
much.
my pleasure. It is my pleasure.